Welcome to this webinar on the dietary management of gut symptoms during the menopause. My name is Marianne Williams and I'm a specialist gastroenterology dietitian. And I'm joined today by two menopause specialists.
Hi, I'm Cath Munro. I'm a GP up in Kendal in South Lakes, and I'm a British Menopause Society accredited menopause specialist.
Hi, I'm Leah Seamark and I'm a community gastroenterology dietitian working for Somerset NHS Foundation Trust. And my interest in menopause really stemmed from the fact that within my clinics, I was seeing lots of women going through the menopause who were suffering with gut symptoms. And that's kind of where my interest in this area stemmed.
I think it would be really useful to go through the type of symptoms you both see in your different clinics. Leah, you see patients in your dietetic clinic. Can you tell us what you see as the classic symptoms for perimenopausal and menopausal patients?
Yeah, so it's a real wide range of symptoms and they do vary person to person in terms of frequency and severity. So some of the common gut symptoms we see are bloating, and sometimes that bloating can be quite severe. So it almost looks like people, look like they're 4 or 5 months pregnant. So it's not just a little bit of distension. It looks like that they've got a gut full of air. We've also get stomach pains or stomach cramps, a change in bowel habits, so either going one way, so getting more constipated, or maybe having slightly looser stools, but also kind of urgency to open that bowel, so that ability to kind of control their bowel habits becomes more problematic.
Cath, in your GP practice, what sort of perimenopausal and menopausal symptoms are you tending to see in your patients?
Those that have a history of IBS tend to see a worsening of that. But I also see people, I think it's really common for people to start to experience a difference in the way they react to food, whether it be, finding caffeine or alcohol causes an exaggerated response, or for some people, a worsening of their symptoms. That might be associated with bloating as well, but bloating may occur by itself, just as the bowel symptoms can as well. So it's a whole variety, and it will be down to estrogen and progesterone receptors throughout the body, and throughout the gut, and the way that influences both our gut and our brain. For those people that are experiencing symptoms, it's definitely worth speaking to the GP, partly to just go through it and make sure that it's not other causes, but also because there are things that you can do about it.
There are other reasons why your bowels can change or your gut symptoms can change. And I think it's really important that we make sure that people aren't missing something. So if they're getting persistent or unexplained changes in their bowel habits, or particularly if you've got blood in your poo, or any bleeding from your bottom, or you've got unexplained weight loss, or you start to suffer with extreme tiredness for no reason, I would say you really need to go and see your GP. Would that be correct?
I would absolutely echo that. I think so. If someone comes to see me with, because menopause can be so wide ranging in symptoms, it's not uncommon, even though that guidance says you don't need to check blood tests over the age of 45. I would say it's not uncommon for me, having spoken to someone and picked up a few little bits, whether it's extreme fatigue, or whether it's around weight changes, or bowel changes, to then have to do some other blood tests to rule out other things. And I always feel like it's much safer to go that way around. We could miss somebody's underactive thyroid, and we don't want to be missing more significant diagnoses such as cancer in the bowel. So it's always worth speaking to your GP at the point that you're experiencing those changes in symptoms.
And I think the other thing, this slide is slightly different, which is looking more at the ovarian side of things. So really important to rule out any problems in the ovary area. So if you've got persistent swollen tummy or bloating, which is not related to eating, or you've got pain in the tummy or between the hips and the pelvis, which is persistent, or you suffer with urgency when needing to pee, or you're needing to pee more often, or you feel full quickly when eating, or you have a strong family history of bowel or ovarian cancer, those would also be what we would call red flags, which mean that we would like you to go and see your GP. Is that correct?
Absolutely right. Yeah. It's why it's important to have a real good insight into your symptoms. So when you go and talk about them with your GP, if that's what you choose to do, that you're bringing these kind of symptoms to the fore and highlighting those, because your GP will pick those up as things that need looking into a bit more, just to make sure that we're not missing anything else.
So why, Leah, why might gut symptoms appear in the first place? I mean, why can they be linked to the menopause?
As Cathy was saying, we have estrogen receptors throughout our whole body, so that involves with our gut as well. So the estrogen receptors within our gut play a role in digestion, and it's been found that changes in the estrogen levels may actually alter the way in which food moves through the gut. Estrogen also has a role in the way our gut microbiome is made up. So within our gut, we have lots of bacteria which make up our gut microbiome, and that has been shown to have an impact on lots of different things within our health. So our immune system, the way our mood, and also the way our gut and our brain talk to each other. Estrogen can also affect our perception of pain, but also with all the other symptoms linked to the perimenopause and menopause, such as poor sleep, tiredness, anxiety, and low mood, that can alter the way that we eat and also what we eat. And some of those changes to our dietary habits can almost make some of our gut symptoms worse. So whether that's skipping meals or opting for more convenience foods because you're tired, or opting for sort of the higher fat comfort foods because of the low mood, when you take that all together, that can have a really big impact on our gut symptoms.
So you're talking about the sort of psychosocial stress. So for instance, when you're really, I know when I've been really exhausted, a bad night's sleep during menopause symptoms, I just haven't got the energy to start worrying about going out and cooking really nice, healthy sort of strawberry salad like we've got here. And it's just easier to pick up something quick and fast. And of course, that's by definition is more likely to upset my gut because it's full of all sorts of other things. Is that what we're talking about?
So there's the menopause type symptoms which affect what you eat, but also at that period of time when women are going through the perimenopause and menopause, it's also quite a social disruptive area with lots of stresses. So whether it is caring for young children, teenage children, elderly relative, trying to balance work-life balance as well as relationships, all of those come in. And if you're trying to manage that as well as try and manage all the menopause symptoms, it can be really stressful. And therefore that again can then lead to the dietary changes that can affect the gut.
That makes a lot of sense. And then you've got the sort of psychological stress, so that gut-brain connection. Can you explain that a bit?
Yeah, so our gut is seen as our second brain. So what our gut is feeling, our brain can sometimes feel it. So, sometimes people kind of describe that sort of nervous butterfly feelings going into exams or periods of high stress. Well, that can affect us throughout our lives. And actually, as I mentioned, we have that psychosocial stress, but also with the menopause, there's that increase in anxiety, which can then trigger off some of those gut and brain connections, making you experience pain.
I know that, for instance, before, I think you touched on it there, before exams, I had so many friends, we waited for an exam, we'd all be running to the loo with diarrhea because, our guts were all upset. So the anxiety that you might feel, which tends to increase with the menopause, or tends to be one of the symptoms a lot of people mention, the menopause anxiety. So, looking at the basis that anxiety can cause diarrhea during exams, and presumably anxiety can cause, for the menopause, can cause all sorts of gut symptoms as well. Is that what you're saying?
Yeah, absolutely.
So we've got a series. So you're watching this webinar on Patient Webinars, which is a free NHS service. And on the same website, we've got several webinars that patients might feel are helpful. Leah, which ones would you particularly recommend for gut symptoms for patients?
Okay, so if you're having gut symptoms and you've ruled out anything sinister by looking at those red flag symptoms and speaking to your GP if needed, if you're looking to try dietary changes to help with that, one of the ones we have is the first line dietary advice for IBS, so irritable bowel syndrome. So some of the advice in that you could look at to see if that helps manage some of those gut symptoms that you may be experiencing. People often also describe sometimes feeling more constipated during that period. So there is also a webinar on there about dietary advice for constipation, which can be quite helpful as well.
I know that a lot of patients, if they're getting sort of IBS type symptoms, are being channeled directly to a diet that's now extremely popular and is also very well researched, called the low FODMAP diet. But what's your feeling about that? Because I don't think that should be the first line approach for patients with gut symptoms. What's your feeling about that, Leah?
Completely agree. So the low FODMAP diet is a diet which looks at fermenting carbohydrates which sit in the gut ferment, producing gas, which can lead to bloating in some people, but also can draw water into the bowel, which can then lead to looser stools. The thing with the low FODMAP diet is that it can cut out quite a lot of different foods, or quite a wide range of food groups, and can be quite restrictive. So it's there as a second line option, but the first line option, which are the things that we'll discuss in a moment, are more about lifestyle changes. They're less restrictive. So when it comes to symptom management and diet, what we're trying to do is find the least restrictive measure to get symptom control, to feel like you're in control of your symptoms. Now, when it comes to conditions such as irritable bowel syndrome, there is no cure. So what we're always trying to aim for is to make those symptoms more manageable for you and give you a bit of control. And some of the first line sort of lifestyle changes and dietary advice have been shown to be really effective in people with those symptoms. So that would be something that we would always recommend trying before considering something like the low FODMAP diet.
Yeah, so you could avoid having to do something as complex as the low FODMAP diet, because you might find the first line dietary advice is all you needed to do.
Yeah, absolutely. And actually some of that first line dietary advice, yes, it's appropriate for sort of irritable bowel syndrome, but also some of that advice is actually beneficial for some of those other symptoms we discussed in relation to the menopause. So with the first line dietary advice, it's looking at avoiding some of those known irritants to the gut. So alcohol is one of those known irritants. So we're looking at trying to make sure you don't go beyond the recommended 14 units a week, and trying to spread those, if you do drink alcohol, spreading it out throughout the week, and trying to have at least 2 or more alcohol-free days a week. Caffeine, again, is also an irritant, so a bit of a stimulant to the gut. So some people often describe, after having a cup of coffee, having to rush to the toilet. So again, it's trying to limit your intake of caffeine and trying to have no more than about 400 milligrams of caffeine a day, which is the equivalent of about sort of 3 to 4 cups of brewed coffee. 10 cans of Coke, but if I'm honest, I wouldn't ever recommend having up to 10 cans of Coke because it's really, really fizzy, which again can lead to gut symptoms in itself. And limiting sort of the intake of the ever popular sort of energy drinks that are available in the market at the moment. And I suppose when it comes to alcohol and caffeine, they have been linked to increase some of the other menopause symptoms as well. So such as sort of sleep disturbances, hot flushes, palpitations, increased urgency, and the ability to sort of manage stress and anxiety. So not only, trying to limit your intake of alcohol and caffeine may help with gut symptoms, but it may also help with some of those other symptoms as well.
I think anxiety is a very interesting one. And I know, for instance, from my own experience, that if I'm not good with caffeine, if I have caffeine, I start to feel very anxious and slightly, worried, not quite sure what's going on. So, for some people, having several cups of coffee a day, it might make quite a big difference to their anxiety levels if they reduce that down.
Yeah.
Would you agree with that?
Yeah, absolutely. And I think, again, it's about knowing your starting point. So if you're someone who has 10 cups of coffee a day, going down to just having 2 or 3 might be quite a big jump overnight. And actually, you may find you're feeling quite bad in terms of the symptoms associated with that. So it's about knowing your starting point. So have a little look over your week or your day, figure out how many caffeinated drinks you're having, and then look at gradually reducing it over a period of time. Same with the alcohol as well.
And would I just add in there? Sorry, Marianne. I just think the other thing to highlight, and Leah mentioned it, but I think because we haven't really covered it off in and of its own right, is bladder symptoms around this time, which we know change as well. And I do get ladies come in saying, well, I've always drunk 4 cups of coffee a day and I've been absolutely fine. But the impact of losing estrogen and then continuing doing the same things, it can be quite pronounced. And so the potential for reducing alcohol and reducing caffeine can be massive on bladder symptoms, whether that be getting up at night and going for more wheeze than you would have done before, or whether it's that urgency during the day or needing to know where the toilets are. That doesn't need to be a natural consequence of aging. And actually, even without doing anything else, just reducing or stopping caffeine, you can have a massive impact on those symptoms. I just wanted to highlight that.
That's really interesting, because that is a big issue, actually. And another reason for waking up at night and getting disturbed sleep, isn't it? Mm-hmm. Is the needing to wee. So you're saying that if you can reduce your alcohol and caffeine intake, that may help prevent the bladder irritation or the need to go to the loo so much.
Absolutely.
So what about spicy food, Leah?
Yeah, again, spicy food as well as fatty food are shown to be sort of irritants to the gut, so can increase gut symptoms in some individuals. So again, if you're finding that you are having symptoms following high intakes of spicy food or fatty foods, again, that would be something to look at reducing. Spicy foods, when it comes to the menopause, has been linked to hot flushes for some individuals. So again, it's another kind of benefit of trying to limit the spicy food in terms of maybe trying to reduce the frequency of some of the hot flushes if experienced associated with that.
And the
Can I ask a little question there? Just in terms of reducing fat, because I think if I was reading that, well, I read that, you know, does that mean I should have low fat foods? Because obviously low fat foods will often replace with sugar instead, won't they, or sweeteners or other things, or flavorings. Is it better to go to a low fat food, would you say, or is it actually better to just look for alternatives or look for kind of natural vegetables, spices, fruits, etc.?
Yeah, I think to start off with, it's looking at those high fat foods that don't provide much other nutrition. So if you're having, you know, lots of, you know, chocolates or cakes and biscuits, it's looking at limiting your intake of those things, or sort of takeaway foods. We often find people who go and have their fish and chips from the takeaway, they get a lot of sort of diarrhea leading to that. So for those situations, it's more looking at that side of things. And actually, some people find that, you know, when you're talking about sort of dairy foods, I wouldn't necessarily recommend sort of the low fat versions. It's looking at maybe monitoring your portion sizes.
Sure.
So, you know, when it comes to, you know, cheese, are you having the recommended portion, which is the size of a small matchbox, or are you having more than that? So from that side of things, I think to start off with, it's looking at limiting your intake of the high fat foods, which don't provide a huge amount of other nutritional value. And then looking at sort of some of the portion sizes of the other ones as well.
Okay. And what about lifestyle?
The lifestyle is really, really important when it comes to managing some of these gut-related symptoms. So when we talk about lifestyle, we're talking about looking at sort of 3 meals a day. So breakfast, lunch, and dinner, and trying to take the time to actually sit down and eat that meal in a digital-free zone. How many people these days are, you know, on their phones or watching Netflix or watching a TV program while they're eating? And when they're doing that, they're not necessarily being mindful of what they're eating, but also there can be that tendency not to chew the food properly and gulp air down at the same time, which can lead to some of the gut symptoms. So it's trying to make those meals relaxing, mindful, and trying to chew that food properly when you're actually eating it as well.
I think the digital free zone is a very interesting one, because it's so tempting, isn't it? You might be sitting there having your breakfast and you think, oh, well, I'll check my phone and my emails while I'm eating. And actually, you're not going to be digesting as efficiently if you're not just relaxed and enjoying the moment. If you're stressed because you're looking at emails and having to answer stuff while you're eating, I presume that's going to affect your digestion.
Yeah, absolutely. You know, your gut needs a bit of a rest as well. And it's going to be working hard enough as it is in terms of when you're eating. So actually just giving your body the time to sit down, enjoy that meal, and like I say, chew it properly so you're not gulping lots of air down at the same time when you're eating. And from a menopause point of view, when you're going through that transition, your body's ability to regulate your blood sugar levels changes. So actually, you know, eating your regular meals can kind of sometimes help maintain those blood sugar levels, so you don't get all the spikes in your blood sugar levels, which can then lead to some of the cravings that some people experience.
There seems to be a lot of discussion these days on looking at different ways of eating, so intermittent fasting. But I gather from what you're saying, Leah, it's about having regular meals and giving your gut a break in between these periods. But I'd really be interested to know what your opinions are, both of you, on this concept of intermittent fasting or restricted eating.
So I suppose when it comes to gut symptoms, the evidence shows that people who eat regular meals, so when I talk about regular meals, I mean not skipping meals, so not skipping lunch, you know, eating regular meals has been shown to be beneficial to gut symptoms. I suppose when it comes to sort of intermittent fasting, it depends on what you mean by that. Yes, it is beneficial to have a period of time when you are asleep, when you are not eating. So, you know, if you were eating, constantly snacking and grazing 24 hours a day, you know, your gut environment's not going to have the time it needs to sort of regenerate and process things. So it is beneficial to have a period of time, at least 12 hours, when you are maybe not having anything to eat.
If you have dinner at 7 o'clock at night and not having breakfast till 7 o'clock the next morning with no snacks in between would be a good idea. Is that correct?
probably the easiest way to think about it is avoiding those late night snacks, and not having a compulsion to eat as soon as you get up in the morning. So giving your body a time, as Leah said, when it's not having to digest, when it's not having to process, when it's not having to respond to a sugar spike. So there is evidence around, growing evidence maybe, that having that time is good. But then, when we get into the longer fasts and things, I think there's still much more that's up for debate about the benefits.
Leah, when we're looking at gut symptoms related to the menopause, what's your feeling about the use of elimination diets?
I suppose to start off with, if we're talking about elimination diet specifically for gut symptoms, that, as I mentioned, we want you to try the first line advice first and the lifestyle changes. If they are ineffective in managing your symptoms, there is some evidence for certain types of elimination diets. So we've mentioned briefly the low FODMAP diet. Some people can find some beneficial effects by using single elimination. So, for example, a low lactose diet. So the lactose is the sugar that you find in milk and milk products. So some people find some symptom benefits by following a low lactose diet. But I suppose when it comes to those two types of diets, you only want to be following them from a limited period of time and monitoring your symptoms. So the first thing is knowing what your symptom profile is first. If you decide to try a low lactose diet or a low FODMAP diet, it's following it for a short period of time. So maybe sort of, 2 or 3 weeks for a low lactose diet, up to 4 weeks for the low FODMAP diet. And then the key thing is always about reintroducing. So even if you found symptoms improvements on a low lactose diet or symptoms improvements on the low FODMAP diet, it's still really important to reintroduce to find your personal tolerance levels, because most of the time people can tolerate a level of low lactose or a level of low FODMAP without any symptoms. And as I mentioned, we want to try and follow the least restrictive diet possible to get the symptom improvements. And really, those types of diets should be done with the support of a dietitian. One, to make sure it's the right diet for you, but two, to make sure that you are still getting the nutrients your body needs. And I suppose thinking about menopause, one of the nutrients we've talked about is calcium. Now, so many people we sometimes see in clinics say they've gone on a low lactose diet, but what they've done is just actually cut out all forms of sort of the dairies, cut out milk, they cut out cheese, and not necessarily use alternatives. Now, by doing that, what they've done is significantly reduce their calcium intake, which can then have an impact on their bone health. So working with a dietitian can kind of help to make sure that if a certain type of elimination diet is seen to be appropriate for you, is that you're doing it appropriately, getting the right nutrition, and then you have that conversation about how to reintroduce afterwards as well.
In summary, what you're saying, Leah, is that when you're looking at the gut symptoms associated with the menopause, elimination diets may be useful, but they really ought to be done under the guidance of a dietitian. And if the diet doesn't work, it should be that food should be reintroduced, and the diet should never be done long term. So if you go on to a particular diet, that's not for life. Foods need to be reintroduced and challenged. And certainly, if you see no improvement in your symptoms, then you need to stop that diet. Is that what we're saying?
Absolutely. And there's further information about the low lactose diet and the low FODMAP diet on the patient webinars website as well, if you wanted further information related to those.
So thank you very much, Leah and Cath, for taking us through this really useful webinar on gut symptoms associated with the menopause. In summary, really what we're looking at is the common gut symptoms are bloating, pain, changes in the bowel habit, and urgency, and that it seems to be changes in the hormone receptors in the body that may lead to these increased gut symptoms. But the other factors such as stress can actually lead to dietary changes that may aggravate the symptoms as well. And it's important to use first-line IBS advice with lifestyle changes before you try anything more complex. And please don't forget about the other webinars on the Patient Webinars website that will be useful for gut symptoms. So we have webinars on IBS first line advice, constipation, and for those that have tried first line advice and found it not helpful, there are also webinars on the FODMAP diet. We really hope that you found this webinar useful, and thank you for listening. Goodbye.